Ja shumë e lumtur që jam këtu sot në fakt sepse unë këtu në Massachusetts jam rritur, kam ardhur shumë e vogël në Worcester, e kam bërë gjithë studimet këtu pak a shumë, kam mbajtur në UMass Amherst për undergrad, pastaj shkollën e mjekësisë e kam bërë në Worcester në UMass. Kam edhe mamin këtu që po bën video. Hi mami! Shumë jam emocionuar që ka mamin këtu në fakt, që më falni. Pastaj kam bërë rezidencën në Georgetown, në Washington DC, edhe tani jam në një praktikë private, bëj general dermatology, shoh fëmijë, të rritur, të gjithë, lots of medical dermatology. Fjalim që do bëj sot, do ta bëj në anglisht, e kam pak më kollaj me këto gjëra teknike. Që fillojmë, më vjen keq që nuk kemi një screen sot, por keni pamfletat e të gjitha tavolinat, kështu që shpresoj që të shikoni aty. So what is skin cancer? Skin cancer is the uncontrolled growth of abnormal skin cells. It occurs when DNA damage to skin cells, it triggers mutations. There are three main types of skin cancer: basal cell skin cancer, squamous cell skin cancer, and melanoma. So you'll see pictures. One of the most common skin cancer is basal cell skin cancer. It often appears as a small, shiny bump. It has a little translucent appearance to it. Second one is squamous cell carcinoma, and it's the second most common type. Usually it starts out as a little red patch, and then it develops into these red nodules that do not heal. So anything that's taking longer than a month to go away, you really should get it checked out, because usually these present as non-healing sores. The one that we're probably the most familiar with is melanoma. It's one of the deadliest type of skin cancer. It can develop in an existing mole, or it can start up as a whole new dark spot. However, we have to keep in mind that melanoma is not just skin cancer, meaning it doesn't just develop the skin. You can see it really anywhere. It can involve the eye, the nails, you can see it in the feet, inside the mouth, and even the genital area. So these are all parts of our body that really we should be paying attention to, and not just our skin. It's also important to know some of the risk factors, so especially blistering sunburns. Really, even just one blistering sunburn gives you a risk for melanoma. But especially between the ages 15 and 20, it increases the melanoma risk by 80%. The risk of melanoma is also increased by 75% when tanning starts before the age of 30. So there's something called, you might have already heard about it, it's called the ABCDEs of melanoma. And it's an acronym to sort of a simple way to figure out if a mole that you're looking at is skin cancer or not. A stands for asymmetry, so you can think of doing an imaginary line on a mole. Does it actually fold in half or not? B is for border irregularity. If it looks like the mole has like an arm or a leg extending out, then we worry about that being a melanoma. If it has more than two colors, so you can think of pink, brown, black. There's a saying in dermatology, we say pink and brown makes you frown, because there's a high likelihood that that might be a melanoma. And then the last thing is a diameter, if it's bigger than 6 millimeters. So that's the size of a number 2 pencil eraser. Now, if you're all looking at your skin today, and you're gonna say, well, Dr. Delani, you know, some of these spots are irregular. Is it really a melanoma? So if you've had that mole for most of your life and it's never changed and it's always looked the same, then the likelihood it's not a melanoma. So you really have to look out for new changes. So if you've never heard of a total body skin exam, it's essentially a skin check that you do with a dermatologist to figure out if your moles are normal or not. Unfortunately, right now, there are no set guidelines when it comes to skin cancer screening at what age you're supposed to start. So it really depends on your individual risk factors. And if you're not sure, you can always schedule one, and then the dermatologist will tell you how often you have to do it and if there's anything concerning. So things to keep in mind whenever you do schedule an appointment for a skin check. Don't show up with a full face of makeup because it just makes the appointment take longer, and then you can miss things during the exam. So no makeup. Don't wear any nail polish. You can actually get melanoma on your nails. So any pigmented streaks on your nails have to be evaluated. Remove all jewelry before the appointment. I have caught melanoma under the watch because a lot of people don't even end up taking their watch off. Be prepared to be in a medical gown. Usually you're just in your underwear, so no bra. And also have your, this is mostly for women, but have your hair down so that way your scalp can be evaluated. So the primary cause of skin cancer is really UV radiation, and there's two ways that you can get UV radiation. From the sun, obviously, but also tanning bed. Unfortunately, I'm also of the generation where you go tanning before prom, which now absolutely horrifies me when I think about it. So there's two UV rays that we really worry about. So it's the UVB rays and the UVA rays. So UVB, think of it B for burning, and UVA is what causes the premature signs of aging. So brown spots, wrinkles, and so on. So anyone can get skin cancer, unfortunately, but you have to be extra careful if you have light eyes, light skin, previous history of sunburns, especially blistering sunburns, if you spend a lot of time outdoors, if you have a personal history of skin cancer, or if you have a family history of skin cancer. If you live in an area that is high altitude or in a tropical climate, if you are taking any medications that lower your immune system, if specifically if you have multiple moles that look irregular, there's something called a dysplastic mole syndrome, so that is even more of a reason to get skin checks. So the best way to really prevent skin cancer is to protect yourself from the UV radiation. And that goes for all seasons. So rain or shine, you really need to watch out for UV radiation, because even on cloudy days, you actually do have UVA rays specifically that come through. You might not necessarily burn all the time. However, UVA also contributes to skin cancer. So even when it's snowing, even when it's raining, there's actually still UV rays that come through. So the best thing you can do, this is especially important from 10 a.m. to 4 p.m. when the sun is most intense. And another kind of trick to know what the UV ray index is, if you look in your app on the phone, there's on the weather app specifically, you can slide up where it says UV index level. And if it's anything above 3, you really have to be careful. So during that time, especially from 10 to 4, ideally seek shade, and if you're not able to seek shade, make sure you have sunscreen on, and ideally SPF 30 and above. And sunscreen, unfortunately, is notoriously unreliable, especially in the US. Our UVA filter that protects you, especially from skin cancer, are unstable. So you have to be extra careful to also rely on sun protective clothing. So specifically UPF clothing, so you have to look for the sign that says UPF 50. And if you are outside, you want to reapply sunscreen every 2 hours. You have to use extra caution if you're near a body of water, snow, or sand, because they can reflect the sun more. And of course, it goes without saying, but avoiding tanning beds. Consider using a self-tanning product. It's a lot safer. However, keep in mind that even self-tanning products are not a replacement for sunscreen. It does not protect you from the sun. It's just more cosmesis if you want your skin to appear darker. And try to perform regular skin exams at home as well. And if you're not able to get to a certain area, get your partner to look at your skin. And remember to cover up the kids as well. You are okay to apply sunscreen as long as the kid is over 6 months, okay? Before that, really, you should not put the baby out in direct sunlight. It's okay if you have to use a little bit of a sunscreen stick on the face, especially if you're gonna be out for a walk and you just get caught outside. So how to choose the right sunscreen? So you go in front, I don't know, CVS, and it's so overwhelming. There's like hundreds of sunscreen, you don't know what to choose from. Okay? At the end of the day, some sunscreen is better than nothing, but things to look out for. So it has to say broad spectrum. So what that means is that it's covering both for UVA and UVB. It has to be at least 30. I still see sunscreen that says 15 oil, which is absolutely ridiculous, that need to be taken off the market, but that's a different story. So always opt for 30 and above. You have to check the expiration date. I've been surprised how often when I buy sunscreen at the store, it's actually been expired and I brought it to their attention. So check expiration date. Sunscreen become very unstable if they're expired, but also if they're not stored appropriately. So don't keep your sunscreen in the car. Ideally, don't keep it in the shower either, like in the bathrooms, because the temperatures go too high and the sunscreen starts breaking down. Often, we like to keep it in the car because it's easy to apply, but you're lucky if you're getting half of the SPF that's actually recommended there. Vulnerable population, especially children, pregnant and breastfeeding women, really should opt for a mineral-based sunscreen as opposed to a chemical sunscreen. There's some thought that chemical sunscreen can act as estrogen mimicker and gets absorbed, so potentially affecting the baby. So ideally stick with mineral, and also mineral sunscreen are way less likely to cause allergies. And don't forget lip sunscreens as well. Often when you get older, you don't realize it now, but as you get older, you start to develop a lot of dryness in the lips, and that ends up being precancers like actinic keratosis, something called actinic cheilitis, and you can develop squamous cell or even basal involving the lips. So don't forget the lips. Okay. Now, how to apply the correct amount of sunscreen. So for the face, you want to make sure that you are applying 2 finger lengths worth of sunscreen. So what that means is literally you just do 2 lines of sunscreen on your fingers, and that's how you know you have enough for your face. Now, for face and neck, you need to apply 3 fingers, which is a lot if you think about it. Most of the time when I see people apply, they'll just do like a little dab on the cheeks, which is absolutely not enough. So you have to do 2 finger lengths. And then when it comes to the body, you need 1 ounce, which is essentially a shot glass full. Have you ever seen anybody apply a shot glass? Nobody's applying the appropriate amount of sunscreen, which is why people get sunburn. And that is also why you need to rely on shade and also wear some protective clothing. So I might look, a lot of people think ridiculous wearing long sleeve at the beach, but you have to do that because sunscreen is not reliable, unfortunately. So I think people have to get away on just relying on sunscreen. And I have patients that will tell me, well, how am I going to get tan if I use sunscreen? Well, the reality is you still get tan with sunscreen, you just don't get burned because the UVA rays still come through. 3 to 5% of UV rays still go through sunscreen, so you can still get a tan even if you use sunscreen. So I have a slide here, which I hope you can see. This is probably the one practically what would be more useful to you, but it's some of the sunscreen that I love for the face. I personally prefer mineral sunscreens. So these, I arrange them on different price points because I realize not everybody has the budget to spend $60 to $100 on a sunscreen, and I mean the sunscreen prices have really gotten out of hand. But unfortunately, some of the nicer formulations of sunscreen tend to be a little bit more expensive as well. However, I do have 2 drugstore options. Neutrogena just came up with a really nice mineral sunscreen, and it has a little bit of coverage as well if you're looking for a little bit of tint. And Cetaphil has a really nice one, which is like $12. And then some of the other ones are a little bit on the pricier end. However, mineral sunscreen is notoriously difficult to formulate because it leaves a little bit of a white cast. But these I found are probably the most sheer out of all the mineral sunscreens that I've tried. Now, obviously, I haven't tried anything, so if you have a sunscreen that you love, please stick with it. You don't have to switch, okay? And then the second slide for sunscreen recommendation is the one that's for the body. Now, you can use the same sunscreen that's marketed for the face for the body. It's just that most people don't want to use their $50 sunscreen for the face for the whole body. But there's no such thing as sunscreen for the body, sunscreen for the face, sunscreen for the family, sunscreen for the kids. You can just buy one and use for the whole family. You don't need to spend money to buy individual sunscreen. And especially if you stick with the mineral zinc sunscreen, you really can use for the whole family. So, now I'm going to do some rapid fire. I don't want to keep you too long. Myths about skin cancer and sunscreen. So one of the biggest myths I hear is get a base tan before a vacation because it can prevent sun damage, or if you then get a tan again. The truth is, anytime your skin gets dark, it's a manifestation of DNA damage, and that DNA damage accumulates over the years, and that's what contributes to skin cancer when you get older. So lately, especially, there's been a whole craze about products unfortunately causing cancer, and if you scroll all over social media, you'll see a lot about, well, I don't want to use sunscreen because it causes cancer. Well, there is absolutely no evidence that sunscreen causes cancer. If anything, there's a lot of evidence that UV rays cause cancer. So if there's a way for you to protect yourself, you definitely should use sunscreen. And if you're trying to be a purist and like try to avoid chemical, just stick with mineral sunscreen. There's absolutely nothing wrong with using a mineral sunscreen. There's some lovely ones out there. Now, you might have seen specifically some of the sunscreens withdrawn from the market about benzene contamination of sunscreen sprays. That was a different issue that had to do more with the product becoming unstable and the active ingredients turning into benzene. They don't consciously put benzene in them. So, and the issue was with the spray, so if you stick with minerals and lotions, you'll be good. Now, the other myth is only fair-skinned people get skin cancer. However, anyone really can get skin cancer. I have a picture of Bob Marley because he was diagnosed very late with melanoma of the toenails because they kept blowing it off for a long time. So check your nails, especially for you who always wear nail polish. There's SPF in my makeup. Do I really need to wear sunscreen? So the truth is, no one is applying the right amount of sunscreen with makeup because it just wouldn't look good. Your makeup would look very cakey because putting 2 finger lengths worth of makeup is just a lot. So I would not rely on your makeup as having just SPF. You really should be applying sunscreen with the makeup as well. And I have 3 of my favorite tinted mineral sunscreen or makeup here. The Ilia, the Tarte 28, and it's, I think they're lovely finishes if you're looking for a little bit of coverage as well. Can sunscreen lead to vitamin D deficiency? We know that you create vitamin D in your skin with UV exposure. However, again, because people don't apply sunscreen the proper way, it really does not contribute to vitamin D deficiency. All you need is 10 minutes without sunscreen if you really are worried about it before 10 a.m. and you'll be good to go, okay? Now, if all of this failed, everything that I told you about, and you get a sunburn, what can you do to protect yourself, okay? Like how to heal from a sunburn. So one of the easiest things to get is a hydrocortisone, which you can get over the counter if you don't have a physician that can prescribe you one. That's to decrease the inflammation. You can take Advil, like ibuprofen, that also decreases inflammation and helps with the pain. There was a huge study that showed actually taking a vitamin D supplement right after a sunburn can help with healing. It has to be a high dose though. It cannot be like a 500 milligrams. It has to be like 2,000 to 10,000 units of taking a vitamin D. The study actually had 200,000 units, but most people don't even have access to that much vitamin D. And then some traditional things like chamomile tea, compresses again for it being anti-inflammatory, cool baths. You can do oatmeals, and for severe sunburn, you really should see a dermatologist because we do have like strong topical steroids, but also oral prednisone if it's a really bad sunburn. And don't pick at the skin. If you do have a blistering sunburn, you have to schedule a skin check. And when it all fails, you can always apply yogurt. I actually went and checked. I looked this up on PubMed, and there's actually some evidence that because yogurt has probiotics and lactic acid, it acts as an exfoliant to help remove the superficial layer of the skin, and it's anti-inflammatory. So there's recommendations on applying and leaving it on exactly for 15 minutes, and you can reapply it for 2 to 4 hours. It has to be full-fat yogurt without sugars. The handout does have my email if you ever have any questions and want to reach out for anything. And my Instagram, once in a while when I have time, I put together some little educational videos if you ever want to watch them when my kids let me do it. But if you have any questions while I'm here or even later, don't hesitate to reach out. Okay?